The Mental Health Trust covering Norfolk and Suffolk has been put into special measures for a second time because of concerns about patient safety. In a report, inspectors said the number of serious incidents remained high and staff had failed to learn from patient deaths. Norfolk and Suffolk is the only mental health trust in England to have been put into special measures. Here's our health correspondent, Sophie Hutchinson.
Well, we just need to talk about...
20-year-old Sarah and her mum are painfully aware of how hard it is to get help when a mental health crisis hits. Sarah has a history of serious self-harm and attempted suicide, but her mum says the Norfolk and Suffolk mental health services have often abandoned her when she's most at risk.
If Sarah survives until she's 25 with the current level of service and support, then it will be a miracle. We've constantly battled against utter confusion, lack of consistency, poor communication, and looking back, how can you be hopeful when nobody's actually ever given you any hope in the first place?
Today's damning report by inspectors said the Norfolk and Suffolk Trust was continuing to put patients at risk. It was still not focused on learning from patient deaths. The number of serious incidents was high, services were unsafe due to staff shortages, and some patients struggled to access crisis care. The Trust says it's now begun urgent work to address the inspectors' concerns.
We're really disappointed, but we're also really determined to make sure that we address the recommendations and the things that we have to do to get it right.
Since 2013, the number of unexpected and avoidable deaths at the Norfolk and Suffolk Trust has more than doubled.
So this is a picture of my beautiful son Henry.
Pippa Travis Williams believes her son would still be alive if he'd been properly cared for. Henry, an art student, was found by police peering over a bridge notorious for suicide. He said he wanted to die. He was taken into hospital at the Trust but discharged the next day when he said he felt better. 5 days later, Henry hanged himself. Pippa says the hospital should have realised he was at risk.
The whole family are devastated. Obviously he was my only son. I cannot begin to describe how I feel other than I feel I've been robbed, completely robbed of the future I had planned for the last 21 years with my son.
The Trust says it's really saddened when things do not go as well as they would want for their patients. So how did things go so wrong? Back in 2013, the Trust carried out a radical redesign of services, cutting back on experienced staff. It was in response to a 20% cut to its budget.
People in Norfolk and Suffolk will be really concerned that their mental health trust isn't providing the level and quality of services that they will desperately need. So it's important that their needs are met. It's also a wake-up call for the wider NHS mental health system, and it tells us that the long-term consequences of underfunding of mental health services can have very detrimental effect on the quality of care that people are receiving.
The Department of Health says it's undertaking probably the most widespread programme of mental health transformation in Europe. But for people such as Sarah, that promise of change has been broken too many times. Sophie Hutchinson, BBC News.